Welcome back. Today we are going to continue our journey with the cataract, and today we are going to focus on the management of cataract and in particular the surgery. When we think about management of cataract, it really depends on the age of the patient. It depends also on the quality of life for the patient. What is important for him? Is reading more important? Is outdoor activity more important? All these type of things need to be taken into consideration. Sometimes we think at an early stage, we still can try to manage with improving the vision by glasses or by adjusting the light when he reads, or sometimes we have what we call anti-glare type of glasses can help. But really, the treatment of cataract is cataract surgery. So how is cataract surgery? And I'm just going to speak about the concept of the cataract surgery and how it's being done for just a visualization. So this is again our eye that has the cataract. The cataract here is in red. This is the lens. It's all full of cataract. So this is obviously no light is passing and the vision is affected dramatically. So the first step we do is what we call a capsulorhexis. And capsulorhexis is nothing by just peeling the anterior part of the lens shell or the lens capsule in order that we create a hole that can provide for us an access to the lens material inside the lens. This is a very important step in the operation. And usually it's done manually by the surgeon, so he just peel it. And actually the next step is applying what we call a phaco instruments that will start to eat the core of the lens to clean up all the lens material that is clouded or that includes the opacity. And actually, first, before we start this, we divided the lens into small pieces or divide the material in small pieces so we are able to eat part of it partially, but the end results that we need to clean all the lens, preserving the posterior part of the lens. Very important to preserve the posterior capsule or the posterior part of the lens. So the end result should be something that we cleaned all the material inside. We don't have the anterior capsule, but we have fully intact posterior capsule. And why we are saying this? Because this is for us constitute like a bag. And this allows us that when we insert the intraocular lens, the lens that we will be able to see with after that, instead of the lens that we cleaned it up, is we insert it inside this bag. So basically after this, we insert the intraocular lens inside this bag and we adjust it to be exactly central in position. This is all done through a very small incision. It's 2.5 millimeter and it does not require stitches or anything. So this incision closes by itself. So speaking a little bit also about the intraocular lenses. So whenever you're discussing with your surgeon about the surgery, he will probably offer you multiple options. There is one option that you insert an intraocular lens that will provide you with only a distant vision. This means that you are able to see clearly everything on the distant side. But when it comes to reading, you may not be able to read it because what we call it, it's a monofocal. So it provides only for distant vision. And for that case, you will need to wear glasses or you could wear also contact lens. This is one option. And this is actually the most commonly used. However, there are a lot of new lenses or intraocular lenses have been developed recently where they have the ability to provide the patient with the vision on a distant basis, intermediate, like computer screens, TV, it's if not too far, and also at a reading distance. So they provide the three distances. We call it trifocal lenses, or we call it premium lenses, or we call it EDOF lenses. And really, it's a discussion with your surgeon about what suits you the best for your vision. There are also special type of lenses. We use it for special cases. So sometimes if you have a very strong astigmatism of the eye or the cornea is irregular, there are particular types of intraocular lenses that can be inserted and you can see much better with that. As any type of surgery, there is also risks. The good news on the cataract surgery that really any serious adverse events that could happen from the cataract surgery is less than 1%. And majority of them are really manageable. It's not really seen in good hand. The results from the cataract surgery are really very good results. However, we have to mention also that there are some risks, very small percentage of incidents that can happen, but always with any penetrating surgery inside the eye, you can get risk of infection, can get risk of hemorrhage. You also can get risk that the posterior capsule here could get opacification on it. Some of the lens material can grow back. We call it posterior capsular opacification. But this is also can be treated easily by a laser. You can just laser shot that after this. And then obviously, you can also get, in some complicated type of surgery, you can get some edema on the back of the eye, or we call it edema in the macula, or cystoid macular edema can happen also with cataract surgery. What are the future trends with the cataract surgery? I think some of the recent trends happening now get laser-assisted cataract surgery. Basically, what can be done by the surgeon to remove the delicate anterior capsule, very thin layer, can be done now with some laser technologies. We spoke about some of the new developments in the intraocular lenses that allow patients to see on all distances. And then, obviously, we are getting more and more smaller incisions. So we spoke about very small incision, but even more recent surgery started to be even smaller and smaller. And AI now is being used to calculate the power, not only the power of the intraocular lenses, but also to suit the patient the best. So they look at its cornea, they look at its retina, and they tailor the best lens profile for the patient. And then obviously a lot of people are asking, why not there is a drop or a medication that I can take that can resolve cataract? There is a lot of research is going on this direction. However, so far, there has not been an approved treatment to treat cataract from a medical perspective. There are some still in the pipeline. Still, nothing can provide the abrupt, clear visual acuity after surgery as the surgery does. Because anything with the medication, you get it on a gradual basis. Surgery, next day, you should be able to see quite very well after the surgery. So with that, I hope I provided you with an idea about what is cataract, what types of cataract, what causes cataract, and the diagnosis and the treatment of the cataract. Let's talk in our next episode about myopia.